examinee to just go in there and read it and get all the information fast. And that's the reason we call them cram. The questions are also included to give the examinee the opportunity to practice and test their knowledge of content. So it's everything you've got in an abbreviated format. And then the RN practice question book, those books are mainly just that, practice questions. There are plenty of opportunities for the examinee to test their knowledge and practice with all questions written in the NCLEX format. And I cannot overemphasize how important answering questions are to passing the NCLEX exam. The more questions, the more practice, the more likely the examinee is to be successful on that test. I guess you could say the primary difference in those books are the extensiveness in the prep book over the cram book. It's a bigger book, it's got a lot more information, and sometimes you need all that information, and then sometimes you need to cram. And the practice question book focuses on opportunities to answer questions. So all of them together, the combined package of all those books will get you most anything that you would need.
Forgive me if you answered this a bit earlier, but let's say a student wanted to do your online review. Would he or she be better off purchasing the prep, the cram, or both to accompany the review?
It would certainly be good if they would choose both. The content goes very well with the cram book as far as the sequence of it, but all of the books would be good. I would not suggest so much the practice question because we're looking at that point at the content on the streaming video. One of the good things about the streaming video also that the candidate can slow it down and back it up if they miss some information. So as they're reading through the book, no matter which book they choose, the prep or the exam cram book, then they can go back to the content and, as we said, slow it down, speed it up, move from one section to the other. For example, if I'm talking about respiratory and I'm really trying to focus on tuberculosis, then I would want to look at that part of the respiratory chapter in the book that I'm studying, no matter which one that I choose to study, or if I want to really be thorough and look at both of those books. So they can skip to that section. They can, like I said, if they want to just do pharmacology on that content, then they can go to the pharmacology section. And as Clara said, the pharmacology is at the ends of each of those chapters with sample questions included on those. I want to make mention of one more thing about what Clara said a few minutes ago. I believe that our editor, Betsy Brown, has the testing strategies on the website, and so the student or the graduate may want to go to that section of the website and actually click on that and note and be able to get a little bit more knowledge about testing strategies and how they can use those to answer the questions correctly. And with that mentioned, I want to make note of something. Many students tell us that purchasing the books or doing a review early before graduation really helps them in their program of nursing. One of the good things about the prep book is that it divides the questions according to content, and so if they're in school and they're studying about obstetrics or respiratory or psychiatric nursing, the questions are they're lumped together. They are joined together in their topics so that the student can actually just focus on those without having to skip through all the books. The exam cram books are actually integrated into a composite test or a comprehensive test. So that's a little bit of a difference between those two as well. But it is good. It's really good for students that are still in nursing school.
My final question for you all is an extension over Wilda's original comment, and that is, in closing, what are some specific trouble spots or content areas on the NCLEX-RN test that candidates should watch out for in their preparation and in the exam room?
As I told you, the test plan changed April the 1st of this past year, and what they did was they took 3% from reduction of risk, and they moved it up under manager of care. So the management of care gets 16 to 22% of the test. Now, when you look at the test, that's quite a bit. In other words, what I'm saying to them is that I would really focus on what the RN does and who can be delegated, what client can be delegated to the LPN or the LVN or to the nursing assistant. Because after all, remember that the National Council is measuring safe beginning practicing, and so that is a real focus area. Prioritization is another one that they need to know. Room assignment is very important. Infection control is really important. It's categorized under the second section of safe, effective care, it gets 8 to 14% of the test. So they may be asked to make a room assignment for 2 clients that are infected. It's really important that they know about airborne precautions versus droplet precautions versus contact precaution. I mean, Tim, you probably have heard in the news a lot about MRSA or MRSA. So they need to know that that is contact precaution. Airborne precaution is different than droplet precaution, although both of those travel through the air. Both of those infections travel through the air. So they need to know about those things. I would really, really focus, if I were them, on safe, effective care. Just keep in mind that they have to be above the pass point on all of these categories. Although health promotion and maintenance gets 6 to 12%, and psychosocial gets 6 to 12%. They're still important areas. Now, your physiologic integrity gets around upwards to 60% of the test. So that's basic care and comfort, getting 6 to 12%. That pharmacology that we talked about in parenteral therapy, such as blood transfusion, and then it gets 13 to 19%. I'll just go through the rest of these real quickly, but reduction of risk is 10 to 16, and physiologic adaptation is 11 to 17%. But to answer your question, Tim, I would really focus on that safe, effective care, and I would be sure that I kept my client's safety uppermost in my mind. And remember that this is a nursing test, and we're trying to show the National Council that they are a safe beginning practicing nurse. So they need to focus on the critical skill or the critical thinking skill of prioritization and keeping that client safe. And as I said, keeping that in mind, don't be surprised if you have a lot of those alternative items, particularly check all that apply and place in sequence. That's what I would really focus on, although it's all important.
As far as those sequential type questions, a lot of those sometimes are skills, and we do have skills in our NCLEX prep book, which is pretty good. We have developed it and developed a lot more. Any skill that deals with the category or whatever kind of content we're teaching, we try to include skills in there, and that's something that may not be in all books. So that's really a good thing to have.
The graduate needs to realize that this test is not going to be easy. No one accidentally passes NCLEX. They have to be thoroughly prepared to pass this test. And so they need to kind of be like the Olympic swimmer that's practiced for years and years, which they have in their School of Nursing. And they need to go into that test with the intent that they're going to pass the first time, not the second or the third time. That's really a foolish way to look at it. I think that any of our people that are interested in the prep books or the exam cram books, they just need to keep in mind that that's the focus. That's the goal. You know, it's not over until they pass NCLEX, and it will be so sad to go through nursing school and put all that work into passing nursing school and then not pass the NCLEX exam. So they need to be thoroughly prepared before they go to sit for that exam.
Diann, did you have any closing comments to share?
No, I just want to say something back to what Clara had said about the prep book and the prioritization and the skills. We've worked really hard to put a lot of that in there, and also to look at diagnostics and the nurse's role in preparing patients for different diagnostic procedures, as well as what the nurse does afterwards. And I'm not always sure that that's in every skill book or every review book, and so we've made a great effort to do that. So overall, I know I'm probably biased, but I think this is a very fine compilation of work. I'm just a little biased, I guess.
Sure. And ladies and gentlemen of the audience, to purchase those works, NCLEX-RN Exam Prep 2nd Edition, NCLEX-RN Exam Cram, and NCLEX-RN Practice Questions, you can visit either PearsonITcertification.com, or you could purchase the books through the Rinehart & Associates website. That address is NCLEXreview.net. Wilda Rinehart, Clara Hurd, Diann Sloan, thanks very much for sharing your wisdom with us today.
Thank you, Tim.
Let me say one other thing. If
Sure.
the candidate wishes to email us, they can reach us at the website. They can reach me at wilda@NCLEXreview.net or Diann@NCLEXreview.net. So we would love to hear from them.